At my bottom, I was able to eat, this was my diet, steamed cauliflower and Uncle Ben's rice.
Wow.
That was it. Anything that had protein in it caused a terrible reaction in my body. So how do you fix these things? And the main motivation was getting myself well enough so I could get back into the business of helping people.
Yeah.
And of course, along the way, everything I discovered was useful to bunches of patients. And so I was back in practice helping people who were, fortunately, none of them got as bad as me, but they were moving in that direction.
And a lot of people are moving in that direction, not realizing it. Hey, I'm Dr. Ekberg with Wellness for Life, and today I have the great pleasure and honor of talking to a legend in our own time. This is Freddie Ulan, who is the founder of nutrition response testing, which is the technique that we primarily use to evaluate patients in our office. What led to the development of this whole technique?
Wow, that's first of all, thanks for having me on here.
Absolutely.
You know, I admire you, I admire the work you're doing, and the fact that you're helping so many people and so dedicated to restoring health naturally.
Thank you.
And that's kind of sums up my own story right there, because I had my, I've been in the natural health industry, so to speak, as a chiropractor since 1965. So I'm celebrating my 53rd year as a chiropractor. And I was a straight chiropractor, just did manipulation, and I was raised with chiropractic as my health tool. Mm-hmm. Very rarely went to medical doctors. Mm-hmm. But sometime in the 1980s, I started to get sick. I started to lose my health. And I didn't know until later that it was actually pesticide exposure, but I was mysteriously getting sick.
So how old were you when you first started noticing?
42.
Okay.
1986.
Okay.
I was 42 years old. I was actually at the prime of my life. I was very energetic, working hard, enjoying myself, traveling, helping a lot of people.
Yeah.
I was on a crusade actually, which was many, many hours of my year, 1986, 87, 88. I was traveling around the world, educating parents as to the dangers of psychiatric drugging of children, yeah, and the actual handling of the conditions that they were given drugs for, which is all nutritional, by the way.
Yeah.
And so I was on a crusade, mm-hmm, and I thought, well, maybe I just got tired. You know, it wasn't, because spiritually I was at my peak. But physically, I was just starting to get sick. I lost my health. And by 1991, I was incapacitated. I was in bed 24 hours a day.
Wow.
And this is with getting chiropractic care.
Yeah.
But I was losing my ability to digest and assimilate foods. And by 1991, practically anything I ate caused a horrible reaction. My immune system was shot. And by that, I can tell you that when I was lying in bed, which I had to do most of the time, if I didn't move around, my temperature would drop way below normal.
Wow.
And if I would walk around, it would shoot up to 102. I was sick.
Really, yeah.
I had no, and also if I would walk around, I had body pains, which were all cardiovascular. It was kind of like getting an angina everywhere. Mm-hmm. So I was not, I thought I was at the end of my trip this lifetime,
yeah,
so to speak.
I can imagine.
And that was a big wake-up call for me, because I was actually at a point where the best chiropractic, the best nutrition that was available at the time. This is at the very beginning of the alternative medical. So, and I had some friends who were very advanced medical doctors, had no answers. Mm-hmm. Yeah. And I thought it was going to be over. And frankly, when I talked it over with my wife, she said, "Well, let's get outside the box here." And we ended up going to Mexico for some illegal treatments, yeah. Which consisted of a good diet, Strange idea.
If it helps, we gotta outlaw it, right?
The organic foods weren't illegal in the U.S., but you know, it wasn't something people did or even thought about back then very much.
Yeah.
But I had some blood type treatments, vitamin infusions, and I had some stem cell, live cell therapy, and it stopped my decline dead. Mm-hmm. Where I had actually walking pneumonia for a solid year, where I could actually tap my lungs and feel where the water levels were. Oh, wow. On any particular day.
Yeah.
Which made it very hard to sleep because I couldn't lie down, I'd choke.
Yeah.
And within about 2 weeks of being there, I no longer had the pneumonia, but I was still physically wiped out.
Yeah.
And I was no longer dying. And now I had, you know, when you're dying, at least you know you're dying. Yeah. I was prepared. You know, it's like, honey, this is who we owe this money to, and this is where we'll find the money. Yeah. You know, but when you're not dying, but you can't work, now it's actually worse.
Yeah.
You're like, well, how do I get this body supported? I need somebody to take care of me full time. But what do we do here? Yeah. And my wife gave me a challenge at the time. She said, "You're the doctor, figure it out."
All right.
That was heavy.
Yeah.
And we started to research. You know, we didn't have the advantage of Google. Yeah. There was no internet at the time. You know, Al Gore hadn't invented it yet, or whoever it was that claims to have invented it. And we had to go to libraries, and we had to ask around, we had to talk, and we found that the answer to what had occurred to me was actually already known, but very, very well suppressed. Yeah. And that there were actually a small number of researchers who should be, Mount Rushmore should have their heads on these, you know, up there because of how brilliant these people were, how dedicated they were, how effective they were. And amongst these was Dr. Royal Lee. Yes. Who is, you know, anybody who knows nutrition now knows RoyalLee, and I didn't know him.
Anyone who knows real nutrition.
Real nutrition. Yes. Real nutrition. He's really the father of vitamins and many other things. And people like Dr. Weston Price and Dr. Francis Pottinger, these were brilliant people who had proven beyond a doubt in the 30s, 40s, 50s, what effects the modern diet and the toxicity of the modern world will have on our body. And they figured out how to reverse it. Mm-hmm. And this is totally suppressed knowledge. Yeah. And so that opened up a whole universe for me. Here I thought I was, you know, I was a natural healer, and I didn't know this whole universe was invisible to me at the time. And in getting involved in this, I discovered that there were certain breakthroughs that were made on how to actually communicate with the body. Yeah. So that you could actually find out what's going on with the darn thing. Yeah. And these were pretty advanced at the time. And they made sense. And in starting to utilize these things, I started to find out how I can start to repair this body. The problem was that the techniques that existed at the time were a little vague and confusing and hard to duplicate. You know, you had to find the one guy who knew how to do this and the one guy who knew how to do that. And
a little bit disorganized.
It was very disorganized. Yeah. And as my own health started to restore, I mean, literally going from not being able to eat, at my bottom, I was able to eat, this was my diet, steamed cauliflower and Uncle Ben's rice. Wow. That was it. Anything that had protein in it caused a terrible reaction in my body. So how do you fix these things? This is something we weren't taught in school. We weren't taught how to repair and rebuild a body. Yeah. But these guys, these original clinical nutritionists had these things figured out. And then there was a Dr. George Goodhart, who had somehow, chiropractor, who had made some developments where he was able to use the body's reflexes and understanding the neurology, understand how to assess the functional state of different organs using something he called muscle testing.
Yeah.
And this was actually going on from the year that I graduated chiropractic college, so it wasn't part of my education.
Yeah.
And it was just something off on the side that I ignored because I didn't think, you know, it wasn't.
And still isn't part of the standard.
Yeah, it's not routine.
Yeah.
There are some schools that have little clubs and they teach it a little bit. But I saw something in that muscle testing because that muscle testing helped me identify what foods I could eat, what foods I couldn't eat, what vitamins I needed, which ones I didn't, despite what the literature would have to say. And then additional discoveries were made where we're able to finally evolve a system, which is the system as it is today, kind of jump ahead here, so that using this muscle testing procedure and various stimuli, all non-toxic, all non-invasive, totally safe, could actually get a communication with the body to find out where is the stress and what's causing the stress. Is it the common everyday foods that people are eating? You wouldn't think that that could be a problem, but especially today with the genetically modified foods and the pesticides in foods, eating the same thing over and over and over again eventually causes problems.
Yeah.
Is it some hidden immune problem? An undiagnosed because it's not full-blown enough to show up on a medical blood test. Viral situation, bacterial situation, fungal situation, growing number of parasite situations.
Yeah.
And we figured out how to use the body's nervous system and the muscle response testing to determine where the problem is and what's keeping that body part from regaining its normal function.
Yeah.
We call these stressors. Metals. Everybody knows about it now, but when we were doing it originally, this was brand new. Mercury, aluminum, lead, the various chemicals, including the common ones like chlorine, people suffering from too much chlorine intake, fluoride poisoning, not to mention the plastics. And so all these things came together into a package that really kind of finalized itself in 2003.
Yeah.
So I had a 10-year track of finding what was out there and then kind of figuring some things out. And the main motivation was getting myself well enough so I could get back into the business of helping people.
Yeah.
And of course, along the way, everything I discovered was useful to bunches of patients. And so I was back in practice helping people who were, fortunately, none of them got as bad as me, but they were moving in that direction.
And a lot of people are moving in that direction, not realizing it.
Yes.
Even if they're not bedridden. I tell people that the world has changed more in the last 50 years than it has in the previous 50,000. Yes. And it knocks out the weak very quickly, but it takes decades to really kill off a lot of people. So a lot of people are dying, but they just don't realize it. I really admire your mission statement, your purpose to create a working healthcare system for the entire nation. So for those who don't know, Freddie Ulan created an organization, has trained over 1,000 doctors, and each of those doctors have trained and are educating thousands of patients. So this man is responsible for millions of lives, basically. So we thank you and applaud you for that.
Well, you know, the whole reason for the success of what we're doing is because I wasn't alone, and I realized that. And I realized that I had some knowledge I had to share, and who am I going to share it to? When I ran into medical doctors whose patients I was fixing, they would get mad at me.
Yeah.
So they weren't like-minded guys. They felt challenged.
Yeah.
And I decided I'm going to start something here where what I'm looking for is like-minded people, people who realize how bad things are and actually are looking for solutions that would kind of complete their education. Because I'm looking for guys who are dedicated already to natural health. They're restoring health naturally.
Yeah.
And there are a lot of them out there. And we're fortunate enough to attract people like you, who are already successful and effective in what you're doing. But, you know, we're very different than the conventional doctor who doesn't really expect people to get well. He knows it.
Yes.
So he's kind of, you know, he has a certain attitude that he has to have, which is, well, look, if we could just make you more comfortable while you're sick, then we're better. If we can suppress your symptoms somehow, then they consider that is the job well done, because that's as far as the pharmaceutical model goes.
Yeah.
But we're different. We're a different cut.
Yeah.
We think people should be healthy. People should be, so.
What a concept.
Yeah, it's like, if somebody doesn't get well, we worry about it.
Yeah.
I know oncologists, I mean, I know many medical professions, and I know oncologists due to people that I've been connected to and have gotten into communication with these fellows, and I've interviewed them and talked to them and find they don't expect more than 5% of their patients to be alive 5 years from now.
Yeah.
I don't know how they get up in the morning and go to work.
Yeah.
But for me, it's the opposite. If I have 5% of the patients who aren't responding, no less die, I worry about those. That's like you.
Yeah.
So we have a whole different expectancy level. And those are the guys, people like you, who are people like me.
Yes.
That we resonate so well with each other, that I love sharing this knowledge that somehow I came into my hands.
Yeah.
I never, ever had the intention of being some kind of a leader in this area. You know, I wasn't one of these guys who grew up as a little kid and thought, well, one day I'm gonna, you know. No, I was trying to save my life because my wife said, you're the doctor, you do it. And in doing it, I saw that there were so many people who were on the way out, as you say. They're already, their health is declining. It's like a dimmer switch syndrome.
Yeah.
If you say, how are you doing? They say, fine.
Yeah.
Because they're not too much worse than yesterday.
Or than their neighbor.
Yeah. 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 It's just, so the idea of actually restoring health, when I saw what I could do with my own body, and when I saw what I did for people close to me, and then a practice built up. I mean, I was out of practice. A practice built up out of nowhere. We didn't have Facebook marketing, you know? We didn't have anything. All we had was, oh my God, somebody got well.
Yeah.
And when people get well, other people notice and say, what are you doing? You're smiling, you're happy, you lost weight, you know, whatever it is.
Yeah.
So that's, the miracle is really, we're performing miracles, these 1,000 doctors, and they're the ones doing all the work. I mean, I evolved something, but the credit goes to the doctors, these dedicated doctors, who actually put in their time to get trained, and then they go home and they apply it and they let me know how successful it's been. And I'm always thankful to have been somehow a part of that success.
Just like you're saying, we deal with in functional disease, we deal in functional conditions, and we understand that if there is a disease, there's something that isn't working. And that you can make that work again, like you say, restore the body. But that's a completely lost concept. All the people that we have coming through, and they're on blood pressure medication, and they're on anxiety, anti-anxiety, and the medical doctors tell them that you'll be on this for life because nobody gets better. So that whole notion is just completely lost. How would you summarize? You've done a wonderful job of explaining nutrition response testing, but if someone just wants like a 1-minute version of what nutrition response testing is, how would you state that?
You know, I've often tried to work this into a 1-minute thing. I mean, the doctors who do our course to get the full training, they spend several hundred hours in learning all of it. But basically, it's a non-invasive system of testing the body so that the body will so that you can find out what is going on with the body that is keeping it from repairing itself. So it's in chiropractic, we were taught something about the innate intelligence of the body.
Yeah.
And Dr. Palmer, who was the founder of chiropractic, talked about the fact that true healing will be made possible when the analytical mind and the educated intelligence of the doctor can somehow perceive the state of the body through communication with the innate intelligence of the body. And he said that at some point this will be able to happen. Now in Star Wars, you might remember the doctor on the ship, was it Scotty? He had a machine that kind of would, and he buzzed up and down the body, and he got a readout. Yeah. Well, that's basically what we're doing. Yeah. But we're using a muscle test to get that readout. Yes. And so we get the readout. It takes a few minutes to do an assessment, and you go, okay, the guy comes in and he's got chest pains. And so he's been trying to handle it by addressing his heart. Well, the thing is that the heart is an organ that coordinates with other organs in the body. And sometimes when you're treating the thing that's hurting, it doesn't get well because that's the effect point, it's not the cause point. Yes. So nutrition response testing is a method of finding out the actual underlying causes of situations. It's not a diagnostic procedure. It doesn't say, well, you have this disease. Yeah. It's a system of identifying the underlying, usually hidden to modern examination procedures and blood tests and things like that. Yeah. So it finds the underlying causes, and once you have the actual underlying cause, it opens the door to a handling. And the miracle is that the handlings are generally in one of two categories or a combination of both. It's either a nutritional deficiency or a toxicity, some sort of toxicity, or a combination of the two. Yeah. And these things reduce normal function, they reduce the immune system, opening up the person to viruses and bacteria and parasites and things. These are the things that suppress the body's ability to respond. Yeah. So when you find the underlying cause, and then you have several approaches that we can use, which are all natural, to restoring the function by eliminating the toxins or building up the organ, or both, either together or in sequence. That's what it is. I mean, it makes sense. People who have been struggling to find answers to their health, when they hear this, they go, oh my God, why isn't my doctor doing that? Well, now your doctor is doing it. Yeah. And it's kind of miraculous. It's fun. You know, it actually turns this whole activity into a fun activity, because people start getting better, and there's nothing more fun than that.
So you've been around, I've done this for a few years, and you've done it for a few more years. And you mentioned the two factors, either a nutritional deficiency or a toxicity of some sort. Right. So in your opinion or experience, what do you see as the dominating factor, especially in the last 10, 15 years?
Well, it's a combination of things. It used to be that you could eat whole food, whole fresh food, and you would get all the nutrients that you needed. Yeah. And it didn't make you sick. Yeah. Today, even going into stores like Whole Foods Market, I use that as an example because people think of it as a health food store. Well, you see signs that say conventionally raised food, organically raised food. Yes. And you think, well, conventional, that's my thing. I'm a conventional person. Yeah. Oh my God. Yeah. They've redefined conventional. Yes. Because conventionally raised food means that they use pesticides, which are poisons, in order to raise that crop. Yeah. Now that's not conventional. I mean, if your whole time span is only 50 years, maybe it's conventional. But if you actually look at the human race, that's not very conventional. Conventional is things growing and taking care to keep the soil in good enough shape so the bugs aren't thriving, and you take care of your plants and you eat these things and it nourishes you. So today you have a double problem of eating commercially raised food, which is poison. Yeah. So you get a combination of nutritional deficiency and toxicity. I've often told my patients, and I tell this to every doctor that we've trained, you've heard it from me, that there is no system of natural healing that will overcome the standard American diet. Yeah. So the common denominator is what they're eating. They've been miseducated to thinking that things like Cheerios are food.
Yeah.
Or that commercially raised eggs are food. It's so interesting because if a person ate commercially raised eggs, chicken eggs, they can't eat more than a few a week without it actually affecting them badly. And the doctors will tell you, oh, don't eat more than 2 eggs a day, or, you know. But if you were actually eating eggs from chickens that were raised outside on clean grass and, you know, without genetically modified foods, those eggs are almost a perfect food, and you can actually live on them pretty much. You know, I mean, I hate to tell you how many eggs I eat, but my body loves. But if I go to a restaurant and eat eggs, I can feel the difference.
Yes.
So the common denominators are the two, because when you add the toxicity from the environment to the toxicity in commercial foods, you have a serious toxicity problem. So the two of them feed into each other. When you have a body that's already weakened from commercial foods, exposed to chemicals in the environment, it just can't get rid of it all. It's not strong enough. So that's why our programs always consist of how do we gently detox the person, help them. By detox, I'm just talking about eliminate the poisons that are accumulated in the body in a way that's very gentle, so that they're not upset by it, they don't get sick from moving these things around, and at the same time feeding them, so you're gradually building them up and you're gradually emptying the garbage out. And you see people's health return. It's kind of like reversing a dimmer switch. You know, if you've ever been in a room where there's a dimmer switch, and if you started out, the room was really bright, and every 15 minutes somebody turned it down a little bit, At the end of the day, you're sitting in the dark, you don't even notice it, and that's where most people are with their health. They're functioning at such a low level, but they haven't noticed that it's not how they should feel. They just know something's wrong.
I use that same analogy, and I call it a health reserve. And it's just like the dimmer switch, that at 100% light, it's where we're supposed to function. But then we turn it down to 50%, and we're not dying or living, but we also may not have any symptoms yet at that point. And that's where a lot of people live. And then they drop a little further, and now they get a symptom, and then they go and get a pill, and now they don't have the symptom for a little while, but they still don't get the concept of restoring, turning that dimmer switch back on.
That's exactly right. And as that dimmer switch goes down, their health reserve dissipates. So when something happens, where they get a shock of some kind, or an injury, or exposed to some bacteria or something, they have no reserve to fight that off. They collapse. And so you have people going to the emergency room all the time with things that years ago nobody ever went to an emergency room. But you know why? The reason was that they knew, oh, that just happened, I'll be okay in a couple of days. Today, they don't expect to be okay because they have so little reserve, it knocks them down. So getting healthy is not somebody come in, this happens to me all the time. People say, I have this disease, what vitamin should I take? And the answer is, I don't know. Let's find out why you have the disease. Let's find out why your body's not functioning correctly, and let's work on that. What vitamin is needed to help improve that? What do you need? What mineral or other supplement do you need to help get rid of this accumulation of bad stuff? You know?
And that's what our channel is all about, and we keep saying over and over and over that holistic health is about restoring the body and addressing the mechanism. If you're missing something, you have to provide it. And yet, 98% of the questions and comments we get, unfortunately, is, what do I take for this? And it's not that people are stupid, it's that they have been conditioned into the wrong model for so long. That's just an automatic, it's a reflex, you take something for something.
You know, the struggle is in educating our patients, and you know you've really won you've really hit the home run. When the patient comes in and says, help me find out what's causing this.
Yes.
What do I do
Yes.
to find out what's causing it?
Yeah.
And you know, I mean, I can give you a couple of examples. For example, this is kind of dramatic, but I remember a patient who came in and his case history said recurring brain tumor, now terminal, wants pain relief, natural.
Mm-hmm.
And when I talked to the gentleman, I found out that he had a brain tumor. They surgically removed it, and it came back. And they surgically removed it, and it came back. And they removed it one more time, and they went in, and they said, we can't do anything more. They closed him up, but the tumor was so big, his head looked kind of like a football.
Mm-hmm.
And he was in incredible pain. And the medication that they were giving him for the pain made him feel dead. But he wasn't dead yet. He knew he was going to die. He just wanted to have a few months of joy with his family. And when we checked him to find out why do you have this, there is nothing natural that's going to suppress that kind of pain.
No.
So all I could do is say, well, look, I don't know about your pain right now, but I am curious to see if we could find out what's causing this. And when we examined him, we found out that what was causing it was chlorine.
Wow.
Now, nobody had ever told him this, and he looked at us kind of strangely and said, well, what do I do? Well, the first thing that we told him to do is go buy a filter that would take the chlorine out of his drinking water and take the chlorine out of his shower water. And we gave him some nutritional supplements that would help the body pull the chlorine out of his body.
Yeah.
And inside of 3 weeks, his pain was greatly reduced, and you could see that the shape of his head was returning. And 6 months down the road, 2 months after he was supposed to have been dead, the MRI found no more brain tumor. And of course, they said, well, the surgery worked.
Yeah, of course.
You know?
Yeah.
And this is an adult, but let's take on the other side, an infant who was having brain seizures, recurring brain seizures that were just, I mean, multiple times per minute based on the EEG examinations, because they had her hooked up to things, and they were doing everything to try to help this girl not have these brain seizures. She was literally a vegetable by now. She was a few months old, and this had turned on shortly after she was born, and it might have been due to some vaccination. We don't really know. We couldn't prove it. Yeah. But when we examined her, what we found was that she had some mercury in her brain tissue. So you have a mother who is frantically worried about her child who's had seizures for her entire life, which is only several months. And all the top neurologists could do, once all the drugs failed, was recommend a major surgery to remove a part of her brain. Wow. And her mother was, you know, this was like, what do you do? They called it a hemiectomy or something like that. And the doctors assured her that the child would never notice the difference. You know the implication of that. Yeah. She came because of a strong referral that we kind of help people find out the underlying causes of things. And when we checked her, this little girl had mercury poisoning in her brain. Wow. And there are only a few natural substances that will help pull that stuff out safely. Yes. And we train our doctors in how to use these things. Yeah. It was literally a couple of drops of something. Yeah. And within weeks, her seizures stopped. So this is a girl who was either going to be dead or going to be a complete invalid all of her life. The number of children with autism, who, this is the biggest nightmare I can imagine. And they become such burdens. These are loving, wonderful kids whose parents are now totally enslaved to trying to do something for this child, and nothing can be done about it medically. And yet we help all of them. Because all of these kids, regardless of whether the cause is vaccines or not, that's the big contention. I don't even care about that argument, other than I discourage people from vaccinating their kids if possible. But once the kid has autism, and they have mercury poisoning, lead poisoning, aluminum poisoning, chemical poisoning, that's affecting their brain, affecting how their organs are working, affecting how their digestive system is working. That's why they're so finicky. when we check these kids out, we find things that we can correct naturally.
Exactly.
That's the, you know, you could just cry about some of this stuff, but it's so wonderful to see these kids suddenly coming around and getting into communication with you and giving you a hug and wanting to examine me in exchange, you know?
Yes, yes. So I'd just like to add to that also, the first case was chlorine and the second was mercury, and these are things that we find in virtually everyone we examine.
That's right.
And evaluate, and yet that may or may not have been at levels that a blood test could detect.
That's the problem.
Yeah.
And there's two problems here. One is that the number of symptoms that these things can cause varies across such a broad spectrum that practically anybody will give you a symptom. You could find it as one of the possible side effects to these things, but they don't check for them routinely anyway.
Yeah.
If a person has mercury poisoning that's locked up in the cells of a particular organ, like many women have mercury in their thyroid gland, it's not circulating.
Yeah.
It's come down maybe because of the proximity to the mercury fillings in their teeth, or just the ingestion of fish that have mercury in it, or some other reason, and it settles in the organ. Once it's in the organ, it will not show up on a blood test.
Exactly.
What shows up in the blood test is what's circulating.
Yeah.
People who are chronically ill don't often have this stuff circulating. It's just locked up and suppressing one or more organs. So you need a system that can assess what's going on where.
Yeah.
And fortunately for us, Dr. Goodhart's discovery made in the mid-60s opened the door to a way of looking into the body without radiating it, exposing it to X-ray, without doing exploratory surgery. Again, it's not diagnostic. It just kind of gives you an indication of what's going on. It gives you enough information so that you can apply a natural solution and the patient will either get better or not.
Yeah.
The good news is that that same testing system has evolved into nutrition response testing. We can monitor whether the person is responding or not even before their symptoms change.
Exactly.
So that we know, should we continue this? Should we not continue this? Should we fix it in some way?
And that's true prevention.
That's
handling it before it's even a small problem.
Yes.
At the very infancy. And that's where in the medical paradigm, they think it's all about quantity. If they do a blood test, then a lot is worse than a little. But in the body, it depends on where is it interfering. What critical function is not working because of this toxicity.
Yes. And when you take certain of these things, for example, like mercury, like aluminum, these are in a category of neurotoxin. In other words, they have a very high toxicity to very specific tissue.
Exactly.
So it doesn't take a lot to create a big problem that is expressing itself in many different ways in the body, and it's vague because it doesn't fit any of the traditional diagnoses. Yeah. So very often you have somebody who they're developing a toxicity, or developing a combination of toxicity plus nutritional deficiency, and they have vague symptoms. They go to their doctor for their annual exam, and the doctor says, well, you look all right to me. I realize you have symptoms here, but let's keep an eye on this. Yeah. And what keep an eye on it actually means is, let's wait another year and see if it develops into a disease we can diagnose. Yeah. Because then I have a drug I can give you to suppress the symptoms. Yeah. For us, we want to know, now, you know, years ago I actually coined a term that I didn't realize I should have patented or copyrighted, which is, I said, you know, we're doing something here, we're practicing something called functional medicine. Mm-hmm. And I got that from Daniel David Palmer, who was the first to talk about that in 1910. Yeah. And what we're interested in is what's the functional state of the body or the organs in the body, because it should be at a very high optimum level. And if it is, the person feels great. Yeah. if it's not at a high enough optimum level, the person starts feeling less great and less great and less great. And you could lose 80% of your functional state before you develop a disease that's diagnosable. And by that time, the person's only got this much function left.
Yeah.
So my view is, if the person's dropped, and this is especially true of women. My favorite patients are women because they deserve the support. Nobody supports these gals. They worry about their families, they hold down jobs, they're taking care of their husbands, and they are very aware of how well they're functioning or not. And a woman who's functioning at 95% all the time is doing good. But if she starts hitting 85%, she notices the difference.
Yeah.
She notices it's getting a little harder to take care of the kids. It's getting a little harder to do all these things.
Yeah.
That's the area I want to get into. I don't want to wait till she's developed a cancer or a liver disease or some other serious illness.
Yeah.
I'm interested really in the preventive aspect. And it's kind of interesting that we call this preventive because we're actually preventing it from getting worse.
Yeah.
And then helping the person reverse it.
Yeah.
That's
in the medical model, prevention means finding it early.
Yes.
And by then it's already something.
That's right. I mean, I was traveling to deliver a seminar once, and I was on a plane, and a stewardess stopped by, and she just kind of starts chatting me up, and she said, "What do you do? Where are you going?" I explained I was going to deliver a seminar to a bunch of doctors, teaching them how to utilize nutrition and natural things to help handle illness and reverse illness, and restore health. And she said, I'm so lucky that way. I've never really been sick, never. I mean, aside from the breast cancer,
Yeah.
I've never really been sick.
Yeah.
And it was like, wait a second.
Yeah.
In order for you to have developed the breast cancer, something had to be wrong.
Yeah.
Because that didn't happen overnight.
And we have the exact same thing. We have this form where they check off what their overall health is. And we've had several people check off that they have excellent health, except for the cancer last year.
That's
yeah.
This is just a sign of how we've been so programmed, miseducated.
Yes.
Because the truth of the matter is, if you were to address, and there's a whole medical movement now developing out of the fringes of conventional medical doctors who are just tired of the idea of giving somebody a drug to suppress a symptom, and they're rediscovering this whole concept of functional medicine.
I was going to say that. It was tragic that you didn't patent it, because now there's this whole other movement of functional medicine, and they're working on blood tests, and then they're prescribing large quantities of nutraceuticals.
That's right.
You want to comment on that?
Well, the truth of the matter is that a nutraceutical is a safe drug.
Yeah.
Where a pharmaceutical is an absolute poison, and if you don't give it in the exact right doses, you will create serious problems. Mm-hmm. The nutraceuticals are combined from some pharmaceutical substances and some natural substances, but they're isolated parts of vitamins and minerals and foods. And they're using them in the same way as they use the drug to try to overcome the body's reaction or response to the underlying cause. I know that's a mouthful there, but instead of using a drug to suppress the symptoms of an underlying cause, they're using a nutraceutical, which is not actually a nutrition, to try to change the symptoms, still not quite addressing the underlying cause. There is no nutraceutical that will actually correct the cause of the problem unless it's specifically designed to handle like a mercury toxicity or a lead toxicity. But then you still have to get in there and provide the genuine replacement parts.
Yes, I love that word. I use it on all my seminars, GRP, and people wonder, what's that? It's the genuine replacement part, and that's what nutrition actually is. That's right. The stuff the body needs to rebuild itself. Right? That's
right. If there is a creator for these bodies and this planet, he was smart enough to do that creation and create an environment that would keep these things going. And these bodies are part of the ecology of what ought to be.
Yeah.
And if you take a look in the Garden of Eden, there was whole food there.
Yeah.
There were vegetables that were of such good quality that they could eat those things and they would thrive on it.
Yeah.
The point is that this is where nutrition comes from, and that's what nutrition is. It's actually replacing, giving the body what it needs to replace itself and to restore and regenerate itself. Those people lived a long time.
Yeah.
A lot longer than 60 years.
Yes.
You know?
And they weren't on dialysis toward the end.
That's right. That's right. So,
Yeah.
so you have this whole concept of genuine replacement parts is what we deal in.
Mm-hmm.
The supplements that we use are derived from organically raised whole foods as much as possible. Wild harvested herbs,
Yeah.
which are the way nature grew them to help handle things. Foods that are grown that way. Any of the animal products that are used are purified in a way that there is none of the contaminants in them that are in your commercial meats, for example.
Yeah.
So that these things can actually give the body what it needs to regenerate itself. And that's the interesting point here, because if you think that there's anybody who knows how to heal a body, there isn't anybody who has, that I've ever met.
Yeah.
You can try to micromanage the body's chemistry, and it always results in the next problem up the road.
Yeah.
But if you give the body whole food concentrates with a diet of good foods, the body's innate intelligence will pick and choose what it needs and put it where it needs to go.
Yeah.
And that's what heals the body. All the healing comes from within.
Yeah.
And we're just facilitators. When I examine a patient, part of what I examine is what are they eating?
Yeah.
And I find out that they're eating a typical American diet and wondering why they're sick. How many people have you had come into your office and say, Doc, it can't be my diet. I've been eating the same thing for 40 years.
Yeah.
Well, that's the problem. You've been eating the same
Yeah.
bad stuff for 40 years and your body finally said, that's it. I can't deal with this anymore.
Yeah. I'm completely depleted. You have washed out every bit of reserves I have.
Yes.
So that, yeah, and the same notion with, and once we've been 40 years on depleted food, it's not just a quick fix either.
That's
One
right.
of my favorite cartoons is one of Glassberg, and there's this lady sitting at a doctor's table, and she says, well, don't tell me to change my diet, because I ate a carrot once and nothing happened.
Exactly.
I really, really enjoyed this conversation. I even having heard you speak dozens of times, I still heard some new things. It's always enjoyable. So I hope that you really take the opportunity to share this video with as many people as you can, because this is a legend. He's reached millions of people, and if you share this video, you will save lives. So again, thank you so much for spending this time with us and for your mission to change healthcare. We've taken it upon ourselves to change healthcare in our community, and we can only do it based on the work that you've done. So,
Well, I just appreciate the fact that you're out there doing it. Because that's when I realized that what I knew had to be gotten out, and there was just so much I could do by myself. That's why I started Ulan Nutritional Systems,
yeah,
was to be able to pass this knowledge out. There's nothing worse than knowing how to fix somebody
Yeah.
and not doing it.
yeah,
And there's nothing greater than knowing what to do for someone when they come in and say, Doc, can you help me?
yeah,
And all I can say is, I don't know, let me check you and see if I can help you.
yeah,
And the wonderful thing about this system, as you've experienced and I experienced, I'm always in awe of it, is that it tells me whether or not I can help that person
yeah,
right from the start.
yeah,
And if I know I can help that person, I'll do everything I can to encourage them to get onto the program and realize that they're going to have to invest some time into it.
yeah,
And you know, if it took you 20 years to get sick, you don't get well in 20 days.
exactly,
It could take 1 or 2 years investing
yeah,
your time and your effort and re-educating yourself as to how do I build health. My goal is to have patients not only whose health are restored, but whose ability to maintain their health
yes,
is given back to them
yes,
so that they can take care of their kids.
Yeah.
I'm trying to do us all out of a job.
yes.
That would be my ideal scene.
And we're a whole country addicted to quick fixes. and lose 30 pounds in 30 days and all this nonsense. And that's exactly, that's part of our mission, is to explain how biology works, that you can't cheat nature, that you have to give it time. It's just like grass growing, you can't hurry it up. And if you want to restore the body, it's like you said, it might be a couple of years.
Yes. Well, Dr. Sten, thank you so much for having me on.
Absolutely.
I really love, I love following your practice and what you're doing, and I look forward to hearing about great news from you.
Thank you. Thank you so much.